Hi and welcome. And my name's Gillian Robinson. I'm one of the editors of this resource. And I come from this as, in part, a parent. And because during my paediatric training, it became apparent that actually, when my kids were born, I don't know if I was that ready. And it made me think that perhaps we need to understand as paediatricians how to care for children. Because at the end of the day, I wouldn't take my car to a garage when the mechanic didn't know how to drive. Secondly, before I came into paediatrics, I was a GP, and that helped me focus on seeing children and families and how they live their full lives. But the vast majority of my career has been as a community paediatrician, both in a tertiary centre and now in a DGH. So I have an understanding of the constraints in different systems and also the constraints that we've got at the present time, and that we need to have practical approaches to problems. Over to Dr. Seal.
Hello, I'm Arnab Seal. I am a retired community pediatrician, and I have a very keen interest in medical education, particularly around children with neurodisabling conditions. I have a background both of training in low middle income countries and also practicing both in low middle income countries and in developed countries. I have been part of master's course organizer in Leeds, which has allowed me to further understand how trainees learn, how we all learn. And we have tried within the context of developing this resource to bring in a number of those skill sets to help make the material much more interesting. I have interest in editorial work, and I am associated with both the developmental medicine, child neurology, and the archives in associate editor roles. Over to you, Karen.
Hi, I'm Katherine Horridge. I've got over 40 years of clinical experience, and my training was before paediatric neurodisability existed as a subspecialty of paediatrics in the United Kingdom. And I was privileged to be very involved in the process of getting subspecialty recognition so that we could hopefully improve the lives and experiences of disabled children, young people, and their families. I've been privileged to have various leadership roles over the years, including the British Academy of Childhood Disability and the Training Committee of the Royal College of Paediatrics and Child Health. I've always worked at grassroots level in big district services. In Coventry, I was a consultant initially, and then down in Slough, and then more recently in Sunderland and South Tyneside. So I've experience of different services, and I've also been very involved in the paediatric disability distance learning courses in association with Sheffield Children's Hospital. Our colleague, Dr. Katherine Martin, is the current chair of the Royal College of Paediatrics and Child Health Training Committee, and she is a consultant paediatrician who trained under the new paediatric neurodisability training pathway, and she has a great deal of experience as a paediatrician practicing in the field and as a trainer. So that's a little bit about us.
So I guess the next part is, why did we created this resource? Well, in part because we feel that childhood is training. I'm sure that you're all aware that sadly our children in Britain are the saddest in Europe, and we need to be thinking about how to address this. We also know that paediatrics is training. For all of us, when we started working, it was mainly about infectious diseases, and in the summer months the wards would be virtually empty. But now we've got children with complex health and also disabling conditions. And as a consequence, we need new skills for this 21st century. The college has also acknowledged this, and they've also been changing the shape of training with the introduction of Progress Plus. So it felt timely to think about how to update our original work. And Dr. Seal will tell you about that.
Well, going back about 15 years, Jill, you'll remember that the two of us were very keen to develop a resource which was mainly targeting trainees more at the junior level rather than the specialist level. And after a couple of years of knocking on various doors. We did have a partnership with McKeith Press, and in 2013, the book, which was called The Children with Neurodevelopmental Disorders, was published. In about 5 years' time, as with most books, it had become a bit outdated, and McKeith Press had approached us saying, would we be interested in updating the material and producing a web format? And that got us thinking, because most people, most trainees and other people, of course, have moved away from books. Everybody accesses material online. But the way you work and the way you learn online is very different to books, because you interact, you learn in a different way. And we thought this was a great opportunity to actually produce new material in a different format, which would be interactive, much more interesting. And that's when we started this journey. And that goes back probably about 3 years that this has been in the making.
So now thinking about, well, who are these resources for? Well, really, they're for anybody from any perspective who wants to learn more about childhood onset disabilities and how better to support disabled children, young people and their families. As a focus, we chose level 1 paediatric trainees in the United Kingdom. What level 1 means are trainees early in their paediatric training journey in the first 4 years before they subspecialise. So the resources aren't designed to give all the skills and knowledge that are required to be a consultant in paediatric neurodisability. Rather, they're designed to give important insights for generalists at the beginning of their journeys, what I would call pluripotential stem cell paediatricians, who might go on to be a range of different specialties. They might end up being paediatric allergy specialists or respiratory specialists, or generalists or community paediatricians, as well as some hopefully choosing neurodisability to go on and subspecialise in. So they aren't designed to require a lot of prior knowledge of the conditions that we talk about. So because of that, they're actually as relevant to others coming from different backgrounds. So for health visitors, nurses, therapists, teachers, and for parent carers who might want to look at the elements of the course that are relevant to their own experience. As well as knowledge and skills about disabling conditions, we hope the resources will also give insight into the experiences of children and their families. And how have we managed to achieve that? Well, by using a co-production model, which means we work really closely with children, young people and their families, as well as with experts in paediatrics and with trainees who have helped us to make the resources digestible, usable and practical. Thank you.
It is also probably worth mentioning, while this resource is primarily targeting a UK audience, however, huge amount of this resource is actually generic and would be equally relevant to a broader audience internationally. And we would hope that this is something which will gain traction elsewhere. A little bit about the structure of the course. So essentially, we have one section which we have labeled as the fundamentals. And this section covers all the generic bits which we think are essential to know about to get a broader understanding of the context of childhood onset disability. And within this section, we've got 4 broad sections. One which is called core concepts. And this explores around 10 very key concepts in the field of childhood onset disability. For example, there is why family-centered services are so essential, why multidisciplinary team working is essential, things like the International Classification of Functioning, Disability and Health, which focuses on the fact that your focus is not on cure, but it is more on function and participation. That is what matters, etc. In addition to the core concepts, we also have a section which is around the typically developing child, and that kind of looks at child development at every stage, but also common problems or common issues which crop up during a typical developmental progress. Two other sections which are also key to this fundamentals bit. One is partnership with families, and this follows sort of a branching model where we look at different scenarios of how families experience different neurodiscipline conditions, what support systems are available, and how they can access different aspects of health. In addition, it provides very clear markers for clinicians as to how they can help families and work alongside families to help children. The other section is called Caring for the Disabled Child, and this covers a huge range of topics which are so-called non-categorical, which means these are issues which affect any and every child who may have a disability or not. For example, issues relating to sleep or continence, or issues relating to drooling, etc. So within these areas of the fundamentals module, what we have given is a sense of all the important things that one needs to know about before moving into specific conditions. And then we've got 17 different life stories or modules which cover specific conditions, for example, Down syndrome or Duchenne muscular dystrophy or spina bifida, etc. Do you want to talk a bit more about the...
Yeah, I was going to say a bit about the life stories, because the thing that struck us is that, you know, the medical model is very focused on disease and diagnosis, and it's good at the start of a journey. But actually, it's very limiting in terms of how we can intervene and support children and families. So that we want to try to broaden out that focus for you. We want to think about what children can do in terms of their function, and also how they join in activities or participation. So the life story takes you through from diagnosis, through the child's life up to transition. And on the way, issues will crop up, because issues crop up in all of our lives. And lots of these issues are general pediatric type issues. And lots of them will be children arrive, and virtually every life story, there's a child arriving on a ward. So that this is not a tool that we're thinking sits just in a community pediatric clinic. We're thinking that this is a tool that everybody would benefit from developing. And that's the part of the reason why we've written them as life stories. And finally, what we do with the life stories is we also gives you an opportunity for a bit of feedback about what happens, particularly as a trainee. You often meet families with chronic conditions on a one-off basis, and you don't see the benefits of those actions, because we're looking for benefits in terms of fitness for the child, enjoyment and fun in families, with friendships, so that the child has their best possible future.
The other important aspect, of course, is that we all work within systems, and the life stories allow us to actually explore how we navigate these systems to make things effective for children and their families, and also as clinicians make us feel that we have actually helped the child to participate more and lead a much more meaningful life. Whatever they want to do, they're able to do.
So we hope overall that the resources will help everyone who accesses them to be more confident, to be more capable, with key capabilities that map to the Royal College of Paediatrics and Child Health Progress Plus, but to be confident and so to be able to make the adjustments that really make a world of difference, that might be just small things to think about. And we hope that the resources will equip everyone with those new abilities to be able to make adjustments, to be able to reflect on what life is like for disabled children and their families, how to make their journeys easier, how to deal with the medical bits, but also how to consider those wider needs and the environmental context. So for our core audience of stem cell paediatric trainees, they should be able to weave stories around the resources that we provide and provide evidence of achievement of those key capabilities and competencies along the way. We hope the resources are fun and enjoyable to use, and please tell all of your friends.
Well, we've certainly enjoyed producing them, so hopefully it will be fun. And now we've got a couple of our fantastic trainees who we've worked with, who are going to demonstrate how you can actually navigate the course and sample a bit of the content.